Sacred Heart's pediatric ICU hums with the low electronic whisper of monitors at 3 in the morning. The fluorescent lights cast everything in that particular shade of institutional white that makes time feel irrelevant. Natalie Hayes moves through the unit with movements so economical they barely disturb the air, checking full lines on the 7th bed in her 12-bed rotation, her fingers steady as surgical instruments. 3 months. That's how long she's been here. She wears scrubs like everyone else, navy blue, unremarkable. Her name badge reads Natalie H., RN. Nothing more. Her short dark hair is pulled back tight, the way she wore it in field hospitals in Sanjin Valley. Her hands carry the white scars of someone who's held lives together in conditions where the floor was sand and the ceiling was canvas and the rotor wash of a Black Hawk overhead meant someone's day had just gotten infinitely worse. In her locker, wrapped in plastic at the very back where no one else looks, sit a pair of worn combat boots. Size 11. The leather is creased and stained with dust from places Google Maps doesn't fully document. Her late husband wore them for 14 years across 3 continents. She brought them from storage on the day she took this job, and every morning before her shift, she unwraps them and stares at nothing for exactly 2 minutes. It's not prayer. It's remembering. The photograph taped inside her locker door shows a 17-year-old boy with her chin and his father's eyes. Marcus Jr., home from school when she left for the ICU. She'd made him promise to eat something real, not just cereal and whatever else a teenager considers dinner. Checking the second line again. A voice from behind her, Jennifer, one of the other night shift nurses, holding a cup of coffee that steams like it's been sitting too long. You were just at bed 7. Natalie doesn't look away from the monitor displaying vital signs in soft green numbers. Line looked slightly advanced. Wanted to confirm catheter placement before shift turnover. It's 3 in the morning, Natalie. Dr. Hargrove isn't watching. But that's the thing about training in field conditions. You develop a relationship with precision that doesn't care about time of day or audience. Pain is information. Observation is survival. Natalie nods at Jennifer and continues her round, moving toward bed 9 where a 6-year-old with pneumonia sleeps fitfully under oxygen supplementation. Dr. Marcus Hargrove arrives for early morning rounds at 5:08 a.m., 17 minutes before the official start. He's the type of physician who arrives early specifically so people notice him arriving early. His white coat is crisp. His stethoscope is draped exactly the same way every single day, a prop worn like a weapon. He begins with bed 1. Then 2. Then 3. By bed 7, he's noticed something. Natalie is charting notes on the computer terminal, her back straight, her posture the kind you develop when you've spent years being trained that slouching can get people killed. She doesn't look up, but she knows he's there. She always knows. It's the same awareness that kept her alive through 2 tours in Helmand Province. Nurse, Hargrove says, his voice the particular shade of commanding that men like him practice in the mirror. These chart notations are unusually detailed. She turns toward him, and there's something in her eyes for just a fraction of a second, something that recognizes protocol, understands hierarchy, respects force. But then it smooths away into deference. I document what I observe, doctor. Baseline status and any changes. I can read the monitors myself. His gaze travels down her scrubs, searching. You've been here 3 months. Yes, doctor. Started in June. He watches her hands. They're very still. Your previous employment history was vague on the application. Trauma and critical care, Natalie says, which is true. The part about it being active combat trauma and critical care at a forward operating base in Loga province remains unmentioned. 12 years experience. His eyes narrow slightly, trying to find the scene where something doesn't match, but she's been trained too well to leave seams visible. There's a slight limp when she walks. She doesn't try to hide it or exaggerate it, just lets it be what it is, an injury that healed imperfectly. In his mind, it fits the narrative of someone who worked in a car accident or fell off a ladder. Not someone who carried a wounded 240-pound combat engineer through mortar fire while her own femur was fractured in 2 places. Continue your rounds, he says finally, turning away. And keep your notation to required fields only. Efficiency, nurse, not editorializing. She nods. Of course, doctor. The way she says it, the way every word sits exactly where it's supposed to, no excess, no challenge, confirms his suspicion that she's one of those nurses who simply does what she's told. Competent. Quiet. Controllable. He has no idea that the surgical precision he observed in her hand movements as she adjusted the fall line is the same precision that, on a Tuesday afternoon in Tikrit, allowed her to amputate a Marine's leg below the knee using field shears and morphine while a sniper round punched through the tent fabric exactly 3 inches from her shoulder. Hargrove continues his rounds. By the time he reaches bed 12, he's already dismissed the anomaly. The limp, the unusual attention to detail, the way other nurses unconsciously defer to her even though she has no official authority, these are puzzle pieces he's incurious about solving. This is where he makes his first mistake. By 7 a.m., the day shift begins to trickle in. The unit transforms. Voices rise. The fluorescent lights seem to get brighter, more accusatory. Natalie prepares her hand-off report with the same methodical care she brings to everything: vital signs, trends, medication timing, any concerns noted. The incoming nurse for bed 6 through 9 is younger, maybe 5 years out of school, and she listens with that slightly glazed expression of someone processing too much information too early. Bed 8 scar tissue looks different, Natalie says quietly, pulling up the imaging from the previous day. I flagged it. Dr. Hargrove wants to see it on rounds. The younger nurse nods, writes nothing down, will definitely forget by noon. Natalie doesn't push. She learned long ago that you can't make people see what they're not trained to recognize. You can only be ready when they finally do. She's heading toward the locker room when the intercom crackles, a sound like 1,000 phones ringing simultaneously across the hospital's entire nervous system. She doesn't flinch. Static followed by a calm female voice, Dr. Hargrove, call for 357. Dr. Hargrove, 4357. The other nurses around her exchange glances. Overhead paging meant something, usually something administrative. Natalie finishes walking. But that wasn't the worst part. She's changing back into civilian clothes, jeans, a grey Henley, a jacket that's been through 6 moves and 2 continents, when one of the administrative assistants appears in the doorway of the break room. The girl looks nervous, which means Hargrove sent her. Which means whatever's about to happen was calculated rather than spontaneous. He wants to see you, the assistant says. His office. Now. The walk to his office takes 43 seconds. Natalie counts time the way other people count dollars. She's developing the theory that something went wrong during her shift, though she's certain nothing did. Her procedures were textbook. Her notation, despite Hargrove's criticism, was accurate. Her patient care was. He's sitting behind his desk when she enters. The office is all mahogany and diplomas and photographs of Hargrove shaking hands with administrators. On the desk sits a single sheet of paper. He slides it across the polished surface toward her without speaking. The gesture is meant to be insulting. It probably works on people who haven't been trained to recognize posturing. Natalie looks at the paper. It's a disciplinary write-up. Unauthorized treatment protocols is checked in the infraction box. The date is from 3 days ago, a shift she's certain she worked within every single guideline. The signature is Hargrove's, dated today. This is fabricated, she says quietly. His eyes flash. He was expecting her to ask what she'd done wrong, to apologize, to accept the narrative he's constructed. Instead, he gets a woman in a grey Henley looking at him with the calmness of someone who has already survived worse things than his paperwork. I beg your pardon. His voice goes cold. The incident you've documented, Natalie continues, her tone never changing, didn't occur. I worked within protocol. You're a night shift nurse with 3 months of employment, Hargrove says, his words measured like poison. I'm the attending physician with 17 years at this hospital. Who do you think they'll believe? She doesn't answer immediately. The silence stretches. The fluorescent lights hum above them like insects in amber. You can accept this warning, or you can make it difficult, Hargrove continues, and I can ensure you never work in another hospital in this state. Your choice, nurse. Natalie picks up the piece of paper. She reads it again, every word, every date stamp. She notices the small details other people would miss. The printer quality is slightly different from official hospital forms. The signatory date box has been filled in with a different pen. The infraction code is from an outdated system that was replaced 18 months ago according to a memo she saw on the first day of employment. She folds the paper carefully and slides it back across the desk toward him. I'll accept this, she says, and her voice in this moment is a thing like machinery running perfectly, like an engine that knows exactly how much power it can generate and chooses to use none of it. Thank you, Doctor. Hargrove leans back in his chair. Relief washes across his face. He's won. The submissive nurse has accepted her humiliation without protest. This is exactly how the social hierarchy is supposed to function. You're dismissed, he says. She stands. She walks to the door. Her hand on the doorframe, she pauses, not dramatically, just for a moment. Doctor, one question. He looks up, already satisfied. Why? The question catches him unprepared. It's not accusatory. It's not defensive. It's just a genuine inquiry from someone who doesn't understand the logic of a decision. Why? He repeats, confused. I've worked my shifts well, Natalie says. My patients have recovered. I haven't created problems. So why would you fabricate a disciplinary write-up? He stares at her. For a moment, something flickers across his face, an uncertainty. Then it hardens back into certainty. That's not your concern, nurse. Consider yourself warned. She nods once and leaves. The walk back to her car takes her through the hospital's east parking lot where the morning sun is already climbing toward the Texas heat. She sits in her vehicle for exactly 2 minutes before starting the engine. In the rearview mirror, her reflection shows a woman in a grey Henley who looks tired and ordinary and completely unexceptional. What Dr. Marcus Hargrove didn't understand is that every single detail of this morning, every small humiliation, every calculated move, had just been logged into a specific part of her mind where patterns become data and data becomes action. She had just begun to see him clearly. The cafeteria smelled like industrial bleach and overcooked chicken, the kind of smell that never left your scrubs, no matter how many times you washed them. Natalie had learned to stop noticing it 3 months ago. She'd learned to stop noticing a lot of things. The tray was warm in her hands, lunch she barely had time to grab between rounds, a sandwich she'd eat in 4 minutes if she was lucky, coffee that had gone tepid an hour ago. She moved through the space like a woman invisible, the way she'd moved through forward operating bases in Tikrit, present but not present, noticed but not memorable. This was the skill that kept you alive in hostile territory. This was the skill that kept you employed under people like Dr. Marcus Hargrove. He sat 3 tables over, surrounded by the hospital's hierarchy, Dr. Chen, the chief of neurology, and 2 residents whose names she'd never bothered to learn because they changed every rotation. Hargrove was mid-sentence, his voice carrying that particular tone he reserved for moments when he knew he had an audience. His hands moved as he talked, the hands of a surgeon who believed his own mythology, who'd convinced himself that the white coat was armor. She was past their table, almost clear of the danger zone, when he stood. The motion was fluid, practiced, the chair pushed back with just enough force to seem accidental. His elbow connected with her tray at precisely the right angle. The sandwich fell first. Gravity was indifferent to hierarchy. The coffee followed, a brown arc that should have looked dramatic in a film but just looked pathetic in fluorescent light. The plate clattered against the tile floor with a sound like a gunshot in the sudden silence. Every conversation in the cafeteria stopped. 47 people witnessed what came next. Later, when investigators would review the security footage, they'd time it, 2.3 seconds of complete stillness. That was how long the room held its breath. Hargrove remained standing, his expression arranged into something that approximated regret. Oh. I'm so sorry. His voice was velvet over broken glass. Careful there, sweetheart, these floors get slippery when you're careless. He sat back down, pulling his chair under the table with deliberate slowness. You know, I'm actually making a small wager with Dr. Chen here. I'm betting you quit within a week. How much am I wagering, Doctor? I say she's gone by Monday. Chen didn't answer, but a few scattered laughs rippled through the adjacent tables like infection spreading through tissue. Hargrove's eyes found hers, that particular look of a predator who'd just drawn blood and wanted to see if the prey would run. Natalie moved. She knelt without hesitation, without the tremor in her hands that might signal fear or shame. Her movements were mechanical, efficient, hand-steady as surgical steel as she collected the sandwich, the plate, the scattered apple slices. She was aware of every eye in the room, aware of the texture of the cold tile through her scrub pants, aware of the thermometer in her jacket pocket pressing against her ribs like a second heartbeat. The awareness was data. All of it was data. She didn't shake. She wouldn't give him that. The trembling wasn't fear. The trembling was restraint. She rose to her full height. In that moment, something shifted. It was subtle, a change in her posture, a straightening of her spine, a recalibration of the air pressure in her immediate vicinity. Her voice came out low, steady, with an edge that could cut through bone. I've been shot at by people scarier than you, Doctor. She didn't wait for a response. She didn't need one. She turned and walked toward the trash bin, her scrub shoes clicking against the tile with the rhythm of a metronome, each step deliberate and controlled. The cafeteria stayed quiet. Hargrove's fork hovered halfway to his mouth, his expression frozen in a moment of genuine uncertainty. What the hell did that mean? He'd expected submission, maybe tears, definitely an apology. What he'd gotten instead was something that didn't fit into any category he understood. He set the fork down. Around him, people returned to their conversations, but the energy had changed, the easy cruelty had evaporated, replaced by something more complicated. Curiosity. Questions. Natalie deposited the tray with practiced precision and walked past the nurse's station toward the pediatric wing. What she didn't do was look back. What she didn't do was let anyone see the way her jaw clenched once, then released. What she didn't do was acknowledge the small spark of satisfaction that came from watching his certainty crack. That was the difference between breaking and choosing to appear unbroken. The difference between survival and victory. She clocked into Tyler Reeves's room at 2:51 p.m., right on the cusp of her shift change. The boy lay in the hospital bed like a doll someone had forgotten to pick up, his dark eyes tracking her as she entered. His father, Chief Petty Officer James Reeves, sat in the vinyl chair beside him, a man carved from the same stone that had built SEALs for 40 years, his uniform still bearing the salt stains from the car accident, his face a map of territories he'd conquered and losses he'd counted. Natalie had treated enough military personnel to recognize the pattern, the careful breathing, the way his hand stayed perfectly still on his lap, the eyes that had seen something that made a child's paralysis seem like just another operational detail to manage. "Morning, Chief," she said, keeping her voice level. "I need to run some vitals." The blood pressure cuff hissed as it inflated. Tyler's pressure sat at 118/72, normal for a child his age, which was the problem. Or rather, which was information. She ran through the protocol the way she'd run through medical procedures in a sandstorm, methodical, thorough, missing nothing. Her hands moved on their own, finding landmarks that 8-year-old bodies shouldn't have to surrender to. Tyler didn't flinch when she tested his lower extremities. His legs didn't feel anything. That was what 7 doctors had concluded over the past 48 hours. Irreversible. Palliative care. Start thinking about wheelchairs and disability accommodations and a life lived within certain permanent boundaries. Natalie reviewed his chart during a late shift, alone in the records room where fluorescent lights buzzed like imprisoned wasps. The imaging files were queued on the desktop terminal. She pulled up the MRI scans from the initial trauma imaging, the ones all 7 doctors had examined with the kind of certainty that comes from having already decided the answer. T12 spinal injury. Significant compression, Grade D ASHA classification. The verdict was unanimous and absolute. She'd seen similar patterns in Tikrit. 2007, FOB Bagram, no, wrong base. Different year. IED blast that had taken out the convoy medical vehicle. 2 Marines with what looked like permanent nerve damage, compression patterns that matched Tyler's almost exactly. But those Marines had regained 90% sensation within 6 weeks, once the swelling came down. Once someone aggressively managed the inflammatory cascade instead of settling into the comfortable certainty of permanence. Natalie photographed the scans with her personal phone, the screen reflecting in her eyes like twin pools of data. She cross-referenced the images with 3 different medical journals, pulling up case studies on post-traumatic spinal cord edema, researching the latest protocols for aggressive anti-inflammatory intervention. The information was there. The science was there. The pathway existed, it was just hidden behind the weight of 7 authoritative voices all saying the same thing. She printed the journals at 3:15 a.m., when the hospital was at its quietest, when the only sounds were the ventilators and the distant hum of the fax system. She organized the evidence in a folder she'd never planned to use: compressed scans, treatment protocols, case studies, the pattern she'd seen repeated across 8 years of military medicine. The folder felt heavier than paper should weigh. At 6:19 a.m., she approached Dr. Hargrove as he reviewed charts at the nurse's station. His coffee was still steaming. His expression was still arranged into the careful architecture of someone who'd just woken up convinced of his own importance. She placed the folder in front of him, not pushing it across the desk, just releasing it into the space between them. The compression pattern in the TR12 region, she said, keeping her voice at the level of a nurse addressing a superior, subservient and careful. It matches the inflammatory cascade we treated in Tikrit. The trauma is severe, but the nerve damage might not be permanent if we... 7 doctors, Hargrove interrupted, not looking at the folder. 7 doctors with decades of experience reviewed these scans. You've been a nurse at Sacred Heart for 3 months. He turned to face her, his eyes moving across her face like he was searching for something he could use. Stay in your lane, Nurse Hayes. You follow treatment protocols established by physicians, not instincts. But that was when she saw it. While Hargrove had been dismissing her findings, she'd noticed the second folder on his desk, billing codes for pediatric trauma patients, all marked for equipment rental from Medline Supply Solutions. The numbers were inflated by factors of 3, sometimes 4. Pediatric spinal trauma equipment that should cost $8,000 was being billed as $27,000. The code patterns repeated across 6 different patients. Her eyes caught on one charge in particular, $47,300 in specialized compression therapy apparatus for a 6-year-old with a femur fracture. That child wouldn't need compression therapy apparatus. That child needed surgical repair and healing. Natalie had seen billing fraud in military hospitals. She'd seen what happened when someone found the records. She'd also seen what happened when someone found them and then didn't report them, because the person holding the records had other leverage, other ways of making problems disappear. Hargrove's expression hardened. His eye shifted from hers to the folder, then back again. Something in his face changed, a tightening around the mouth, a narrowing of the pupils. He'd been careless. Or rather, he'd been confident enough that a 3-month-old ICU nurse wouldn't understand hospital billing codes, wouldn't recognize the pattern, wouldn't know what she was looking at. And now he was standing there, watching the moment when certainty cracked. "Thank you for your input, Nurse Hayes," he said, his voice sharp enough to draw blood. "You're dismissed." She turned and walked out of the nurse's station, her shoes clicking against the tile, her mind already cataloguing what she'd seen and what it connected to. The overcharged equipment. The kickback scheme with the supplier. The pressure to declare Tyler Reeves permanently disabled, a declaration that would justify months of expensive, unnecessary treatment. The boy was a symptom, not the disease. The disease was much larger. She had no idea what was about to happen next. The ambulance doors burst open at Sacred Heart's Trauma Bay entrance at 4:53 p.m. on a Tuesday, and the paramedics were already calling vitals before the stretcher hit the concrete. 11-year-old Tyler Reeves lay motionless under the white sheet, a child whose world had fractured in 3 seconds when a pickup truck ran a red light on Richmond Avenue and T-boned their sedan with the force of a claymore blast. His spine bore the impact signature, compression fracture at T9, L2 complex, with ligamentous disruption along the sacral spine. The paramedic's voice was mechanical, 8-year-old male, motor vehicle collision, unresponsive to lower extremities, complete loss of sensation below the waist, vitals holding stable, ETA for minutes. Chief Petty Officer James Reeves sat in the jump seat, hands carved from stone, every muscle in his body locked into a configuration of controlled fury that his years in SEAL Team 3 had taught him, the expression a man wears when he's already running casualty assessments. His son's hand was cold. That was what his brain kept processing. Not the paramedics. Not the sirens. Not the words spinal trauma that kept echoing through the ambulance like a frequency designed to destroy everything a father believed about his ability to protect. Just the cold hand of his 8-year-old child, small enough to fit inside his palm, and the knowledge that Tyler had been laughing 3 minutes before impact, actually laughing at something James had said about the new puppy they were bringing home. Now the puppy sat in the back seat of a destroyed sedan, and his son was being wheeled through hospital doors that looked exactly like every forward operating base casualty reception facility James had ever walked through in Fallujah or Kandahar, except those hospitals smelled like diesel and dust, and this one smelled like antiseptic and something worse, the chemical signature of organized panic. The trauma team at Sacred Heart was competent. For physicians, 2 trauma nurses, 1 anesthesiologist, all moving with the synchronized precision of people who'd done this 1,000 times. Dr. Marcus Hargrove arrived within 90 seconds of Tyler's admission, because pediatric trauma was his specialty, because the boy was Navy family, because this was the kind of case that went on CVS and conference presentations. He ordered a full spine imaging panel, X-rays, CT scans, MRI with contrast sequences to visualize the spinal cord. The waiting room grew darker as the afternoon fell into evening, and James Reeves sat in a plastic chair that smelled like hand sanitizer and desperation, because there was nothing else to do. No tactical problem to solve. No enemy to identify. Just the awareness that his son was being photographed internally by machines designed to tell him if his child would ever walk again. The first doctor emerged at 6:15 p.m., neurosurgeon Dr. Patricia Chow, whose face was already arranged in a composition medical professional's master when they're about to tell a parent their child's world has ended. The compression fracture is significant, she said, standing close enough that James could see the moisture on her lower lip from where she'd been holding the MRI scans. The ligamentous rupture suggests complete disruption of the spinal cord continuity. I'm recommending we stabilize the fracture surgically, but in terms of neurological recovery, she paused. A sentence that long required a breath. The damage appears irreversible. The second opinion arrived at 7:40 p.m. Dr. Raymond Foster, pediatric orthopedic specialist, brought his own MRI discs. He spent 45 minutes reviewing the imaging alone before speaking to James. The spinal cord shows avulsion injury patterns. The signal changes are consistent with acute transection. Without functional continuity in the cord itself, neural recovery is not possible. I would recommend we focus on comfort care and long-term rehabilitation expectations. Which meant, your son will be in a wheelchair. Maybe forever. Almost certainly forever. By 10:15 p.m., 7 different physicians had examined Tyler's scans in sequence. A pediatric trauma specialist from Baylor. A spinal cord injury consultant from the University of Texas. Another neurosurgeon brought in for what administrators called case confirmation. The pattern became clear with each opinion: complete spinal cord transection, irreversible neurological damage, recommend palliative care pathway, discuss wheelchair accessibility modifications with family, consider whether long-term facility placement was appropriate given the child's age and the family's resources. James Reeves had survived 2 bullets, a roadside bomb, and an extraction under fire in Tikrit in 2009, but those experiences had not prepared him for the moment when 7 medical authorities, 7 people with letters after their names, people whose job was to know the unknowable, all agreed that his son would spend the rest of his life unable to feel his own legs. He sat in the ICU waiting area outside Tyler's room and did what he'd been trained to do: he compartmentalized. He accepted the new tactical reality. He began calculating what life looked like in that configuration: van modifications, ground floor housing, physical therapy appointments, the slow attrition of a child's independence. But he didn't know that Natalie Hayes had pulled Tyler's full imaging sequence at 11:23 p.m. while working the night shift, had laid the MRI scans against the lightbox in the radiology reading room with the same quiet precision she'd once used to assess blast wound patterns in field hospitals outside Tikrit. And Natalie saw something the 7 doctors had missed, or dismissed, or had been trained not to recognize because the radiological literature said it was impossible. The compression pattern at T9 wasn't a transection. It was a dislocation with severe cord compression, the kind of injury she'd treated in 3 Marines pulled from a collapsed building in 2007, the kind where the spinal cord was crushed but not severed, where the neural tissue was screaming from pressure but still anatomically intact. The ligamentous disruption was significant, yes, but the spinal cord showed something the standard radiology report had glossed past: a hyperintensity signal in the gray matter consistent with edema, not necrosis. Swelling. Not death. Swelling could be reduced. Pressure could be relieved. Compression could be reversed. Muscle memory took over. Her hands moved on their own, pulling the comparison images, running measurements, checking the vertebral alignment against the baseline CT from the paramedics' field assessment. The numbers told a story the official report had buried: the fracture dislocation was mobile, the cord compression was mechanical, and the hyperintensity pattern meant the spinal cord cells were inflamed but viable. Tyler Reeves wasn't permanently paralyzed. Tyler Reeves was being crushed by swelling and vertebral displacement, and that was treatable. That was reversible. That was exactly the pattern she'd seen in Fallujah when combat engineers were pulled from collapsed fortifications, and those Marines had walked again. 7 doctors. All wrong. She didn't know that Dr. Hargrove had already been making calls. His first call went to Gerald Thornton, chairman of Sacred Heart's board, at 8:52 a.m. the following morning. Hargrove's voice carried the careful articulation of a man talking about problems that needed solutions. "We have a liability issue developing in pediatrics. A nurse, Natalie Hayes, night shift ICU, is making diagnostic claims about the Reeves case, contradicting the medical consensus, potentially interfering with appropriate treatment recommendations. She's creating documentation that could expose us to malpractice if the family acts on her suggestions." Thornton had owed Hargrove a favor since 2019, when Hargrove had quietly buried a malpractice complaint from a patient who'd woken up blind in one eye after Hargrove's corrective procedure. A few phone calls to the right people, some carefully worded statements about pre-existing conditions, and the complaint had evaporated. Debts like that were remembered. "We need to contain this," Hargrove continued. "Immediately." His second call went to a private investigator named Conrad Michaels at 9:23 a.m. Hargrove had used Michaels before, a man willing to conduct background reviews with a predetermined conclusion. "I need everything on a nurse named Natalie Hayes. Work history, references, education. I need the kind of holes that suggest credential inflation. Can you have something by tomorrow?" Michaels said he could. Hargrove paid in cash. Michaels worked for cash. The arrangement was clean. His third call went to Medline Supplies account director at 10:15 a.m. Hargrove kept his voice light. "Hey, about the Reeves case we've been discussing. There might be some complications with the family pushing for aggressive intervention. Just make sure the invoices on that account are clean, no discussion of the margin adjustment we discussed, if anyone asks." The margin adjustment being the 15% kickback on orthopedic equipment sales that Hargrove had been splitting with the supplier for 3 years. Clean invoices meant clean payments. Clean payments meant no audit trail if anyone decided to look. Then he reassigned Natalie. The email landed on her phone at 11:19 a.m. while she was reviewing Tyler's chart on the night shift closure, effective immediately. All ICU nursing rotations are being rebalanced for staff development. Natalie Hayes assigned to geriatric wing, effective next shift. Dr. Hargrove, Department of Pediatrics. Which meant, you're off the case. Which meant, you're being moved away from the patient. Which meant, your access to Tyler's medical records was being revoked. She didn't protest. She accepted the reassignment with one measured breath and updated her shift schedule. But when she arrived for her next shift in the geriatric wing at 10:16 p.m., every single case she'd been assigned had been transferred or discharged. She was put on mandatory floating status. Then she was assigned to deep clean storage rooms and organize supply inventory, work that kept her in the basement, away from patient care, away from Tyler, away from any opportunity to document her concerns about his medical plan. On her third day in the basement, filing boxes of unused catheters and expired medications, she was pulled into the medication room by Dr. Hargrove himself at 1:16 p.m. The door closed. His voice came quiet and measured, which was somehow worse than shouting, "I know you think you're special. Some kind of whistleblower, some kind of crusader. But you're not. You're a bottom-tier nurse with delusions of competence, and I will make you gone from this hospital. I have conversations scheduled with the board next week. I have your background being reviewed by a private investigator. I have evidence that you've been an authorized practicing medicine, making diagnostic claims, creating documentation to undermine physician authority. This is your last warning. Walk away. Quit. Take a severance, sign an NDA, and disappear." He stepped closer. "Or I will destroy your career so thoroughly that you'll never work in another hospital in Texas." She absorbed the words the way she'd absorbed shrapnel impacts, as data, not as damage. She didn't flinch. She didn't argue. She simply walked past him, her shoulder brushing his arm without acknowledgement, and returned to filing boxes. But she'd heard what he'd actually said beneath the threats. He was going to the board next week. A 5-day window. A board review. A termination recommendation. The clock had started. Day 3. That's all it took for everything to collapse into chaos. Tyler Reeves was sleeping when the alarm started, a routine assessment. The chart said, vitals check and spinal fluid pressure reading at 8:47 in the morning. Natalie was 2 floors up, restocking the supply cabinet in the pediatric wing's medication room, when the code blue announcement crackled through the intercom like a rifle shot. Trauma Bay 3, code blue, all available personnel. Her hand stopped moving. The 4 bags hung suspended in her grip. She knew that voice. She knew that tone. She knew, before anyone else did, that it was him. Tyler. The medication room door was already closing behind her before her brain caught up to her body. The elevator took 18 seconds. She counted every one. 18 seconds of fluorescent lights humming overhead like wasps in a metal box, 18 seconds of her heart rate climbing into territory that would have alarmed any cardiologist watching, 18 seconds of muscle memory screaming what her eyes had seen 3 days ago in those MRI films, that spinal compression wasn't his only problem, that 7 sets of eyes had missed something darker moving underneath the surface. Tamponade. The word sat in her chest like a stone. The stairwell was faster. Her shoes hit the tile in rhythm, boot step, boot step, boot step, and she was running before she reached the 3rd floor landing. The ER corridor smelled like copper and antiseptic and the particular electric tang of panic, that ozone-sharp scent that only happens when a room full of trained people realizes they're losing. The code team was there. She could see them through the window, the resident frozen mid-chest compression, the nurse standing paralyzed with the crash cart, the respiratory therapist trying to bag a kid who wasn't responding. But they were missing it. All of them. They were working a code that should have been obvious by now, and nobody was asking the right question. Why wasn't he responding to compressions? Why wasn't the oxygen saturation climbing? Why was the cardiac rhythm deteriorating instead of stabilizing? Because his heart was being crushed from the inside out. She pushed through the doors. The room didn't stop, didn't acknowledge her presence. Nobody noticed when you were supposed to be fired, when you were supposed to be gone, when everyone was too busy dying to register the one person who'd spent 18 years watching kids bleed out in sandstorm dark and learning which wounds could be saved and which were already gone. Natalie's eyes found the monitor. The ECG was a flat scribble, the kind of electrical chaos that meant the heart had given up transmitting and was just collapsing in on itself. Pericardial tamponade. The diagnosis was written in every vital sign. Needle, she said. Nobody moved. 14-gauge angiocath. Now. Her voice didn't sound like a request. It sounded like something that had forgotten how to ask, something that had spent too many years giving orders in places where hesitation cost lives. The veteran ICU tech, Danny Martinez, 3 tours in Kandahar, looked up from the crash cart and met her eyes for exactly 1 second before he understood. He didn't question. He moved. The needle was warm in her hand. She'd held 1,000 of them, but the first one always carried a weight that never diminished. Natalie's fingers found the landmarks: second intercostal space, midclavicular line, the exact topography of a human chest wall that had been burned into her hands through repetition and consequence. The resident started to say something. She cut him off with a look that made him step backward. Keep compressions going. 8 words. The entire room fell into the gravity of her presence, and they obeyed. The needle slid in. Muscle memory. That's what people called it, but that wasn't right. It wasn't memory in the sense of something remembered, it was muscle history, instinct carved into fiber by 1,000 repetitions in field hospitals with no electricity, with mortars walking closer with each percussion of the concussion, with a 6-year-old girl bleeding out on a stretcher and nothing but hands to stop it. Her hands moved with the precision of something that had learned to calibrate pressure and angle in the dark. The needle pierced the pericardial sac. And then, the hiss. Air. Fluid. The compressed heart suddenly given space to beat. It was the sound of release, of a pressure valve opening, and it happened the same way it always did, sudden and clean and undeniable. The monitor jumped. The rhythm spiked. 80 beats per minute. 90. The boy's oxygen saturation climbed like a bird taking flight, 68, 72, 85, 91. By the time the fluid stopped draining into the catch basin, Tyler Reeves had a sinus rhythm and a pulse and a future that 7 sets of eyes had already written off as impossible. 30 seconds. That's how long it took Hargrove to arrive. She heard him in the hallway before she saw him, his voice sharp with that particular rage that only comes when a man realizes his authority has been violated in ways he can't control. The doors burst open. His face was the color of overripe plum. His eyes found her standing over the cardiac needle, Tyler's monitor beeping its steady confirmation, Danny Martinez staring at her like he'd just watched someone raise someone from the dead without even saying a prayer. What in the hell? Hargrove's words came out clipped, strangled, his eyes darting between her and the boy and the monitor and the empty pericardial sac. She saw the moment he understood. Saw the exact second when his brain processed what had happened, that she'd saved a child he'd designated as unsalvageable, a child whose permanent disability was generating the kind of billing codes that made his relationship with Medline Supply profitable beyond measure, a child whose recovery threatened every angle he'd set in motion. The rage transformed then into something colder. Something more calculating. "You're done," he said quietly. "Security. Now." Danny Martinez stepped forward. "Dr. Hargrove, maybe we should." "I said now." Hargrove's voice had dropped to something that sounded like metal scraping metal. He wasn't talking to Danny anymore. He was talking about her, through her, as if she'd already stopped existing. "This nurse is no longer authorized to work patient cases. Effective immediately. Her credentials are suspended pending review by the disciplinary board. Security will escort her from the building." 2 security officers appeared in the doorway within 90 seconds. They didn't look at her. Nobody did. Even Danny, who'd just witnessed her save a child's life with the kind of precision that only comes from having done it 1,000 times in places nobody talks about, stepped backward and found something very interesting to examine on the far side of the room. She understood that calculus. He had a family. He had 20 more years until retirement. She didn't blame him. They took her badge at the entrance. The plastic was worn smooth by her thumb, a tiny gesture of familiarity from 3 months of work, and when the security guard, a kid who couldn't have been more than 23, slid it into the lockbox, it made a sound like a door closing. Permanent. Final. She didn't resist. She didn't argue. She walked out into the Houston heat with her head level and her jaw set the way it was meant to be set, and she didn't let anything show on her face until she reached her car in the employee parking lot, where nobody was watching, where nobody would see a nurse who'd just been fired for saving a child's life press her forehead against the steering wheel and breathe. That night, the rain came down like an accusation. She drove to Memorial Gardens in northwest Houston, the cemetery where they'd buried Marcus Sr. 5 years ago, back when she was still supposed to be someone else entirely. The groundskeeper's shed was dark. The cemetery roads were empty except for her. She walked through the wet grass in her work shoes. They were soaked through after the first 50 yards, the leather going dark and heavy, until she reached the headstone. Marcus Daniel Hayes. Beloved husband. Master Chief, United States Navy. 1967 to 2019. She sat down in the mud beside the grave and didn't feel it. Her uniform was soaking through, they'd made her clock out in her scrubs, hadn't even given her time to change, and the rain was cold enough to sting, but she didn't feel that either. What she felt was the weight of 7 doctors' certainty. What she felt was a child learning to live in a paralyzed body. What she felt was the knowledge that somewhere in that hospital, Hargrove was already making calls, already spinning the narrative, already designing the version of events that made him the reasonable administrator and her the dangerous rogue who'd violated protocol to play hero. She reached down and touched the edge of one of the combat boots she'd left at the headstone 3 months ago. The leather was cracked from age. The laces were still tied, still holding their knots from the last time they'd ever been worn on human feet. "I promised you I'd keep fighting, Marcus." Her voice sounded like it was coming from someone else, someone weaker, someone who'd forgotten the language. "But I can't even save one kid. I failed." The rain hammered down. Nobody answered. Nobody ever did. By morning, the security guard who'd escorted 1,000 employees through those doors now escorted Natalie out of them. Her badge was already deactivated. Her access codes had been revoked at 11:56 p.m. the night before. She knew the exact time because she'd tried to clock in for her 6 a.m. shift and the system had locked her out. The badge clattered against the tile floor as she set it on the desk, a small metallic sound that echoed through the empty pre-dawn corridor like a final word in a conversation that was never a conversation at all. Hargrove had made his calls the previous afternoon. First to Richard Bancroft, the board chairman whose daughter's medical school debt Hargrove had quietly forgiven through a shell company, $187,000 erased, no questions asked, 5 years earlier. Then to Patricia Chen, the hospital administrator, whose nephew had been arrested for a DUI that Hargrove had helped expedite through his connections to a traffic court judge, keeping it off the public record. Then to 3 other physicians with their own secrets, their own reasons to answer when Hargrove said he needed them. The calls had taken 43 minutes. By the time he finished, Natalie Hayes was already a problem that needed removing, and removing problems was something Hargrove had become very good at. The investigator he'd hired, a man named Victor Castellano who worked out of an office above a payday loan place on Bellaria Boulevard, had been given explicit instructions. Fabricate a pattern of unauthorized medication dispensing. Build a timeline showing Natalie accessing controlled substances. Forge witness statements from staff members who'd never actually witnessed anything. The fee was $12,000, paid in cash, non-refundable, and Castellano had done this kind of work often enough to understand that the actual evidence didn't matter. What mattered was creating a paper trail that looked convincing enough to justify termination before any questions got asked. He delivered his file by 9 p.m., 17 pages of fabricated documentation that any competent attorney could have demolished in under an hour, but fabricated documentation was all that Hargrove needed. He needed enough to move fast, before Natalie could speak to anyone, before James Reeves made connections, before the boy's paralysis started showing signs of improvement that contradicted the irreversibility narrative. Natalie had known it was coming. She'd seen the patterns, the way Hargrove's jaw had tightened when she'd reviewed those billing codes, the way his eyes had found hers and held there just a fraction too long, a predator confirming that prey had noticed the trap. She'd spent the evening at home, sitting in the darkness of her kitchen, looking at the framed photograph of Marcus in his dress blues, his hand on her shoulder, both of them young enough to believe that the world made sense. She'd packed her personal items from her locker, a change of scrubs, her trauma shears with the engraved call sign on the handle that only a medic would recognize, a photograph of her son Marcus Jr. at his high school graduation. She hadn't fought it. Fighting it would have drawn attention, and attention was the last thing she needed. What she hadn't anticipated was watching James Reeves's face that morning as she walked through the lobby, escorted by security like a criminal, her discharge papers already prepared, her termination letter citing serious misconduct related to controlled substance access, charges that were so cleanly fabricated that they almost seemed professionally done. James was there because it was Friday morning and he'd been sleeping in Tyler's room every night, and this morning he'd stepped out for coffee and a walk because the ICU had a rhythm that broke you if you watched it without interruption. He'd seen her badge clipped to her pocket, then seen it gone. He'd watched her face, that carefully controlled expression that never broke, not when Hargrove had threatened her, not when she'd been pulled from the case, not now as institutional machinery rolled forward with the unstoppable weight of something that had already decided. He'd approached her at the security desk. Not with anger. Something harder than anger. Recognition. What happened? His voice was structured like a command, like something trained into his bones. Navy SEAL, they'd never discussed it, but she'd recognized the bearing the day they'd met, recognized it the way soldiers recognize each other across rooms full of civilians. Natalie had kept walking. They decided I was a liability. You saved his life. Yes. And they're removing you. She hadn't answered. The elevator doors were closing. She'd stepped through them without looking back, her uniform still smelling like the ICU, antiseptic layered over human salt, the smell of places where people broke and sometimes healed. That night, she'd driven to the cemetery in the rain. The kind of rain that hammered the windshield like judgment, like the sky itself was weighing evidence. Mount Olive, just off I-610, the section where they'd placed him 8 years earlier when his motorcycle collided with a drunk driver on Beltway 8. She'd had a son to raise, a career to rebuild, a promise to keep. She'd kept it. She'd kept it every single shift, every patient, every moment she'd chosen competence over compromise. And it had ended exactly like this, alone in the rain, kneeling beside a granite marker with his name and the years that divided him from her. She'd placed her hand on the stone. Cold. Wet. Real. The combat boots sat at the base of the headstone, Marcus's actual boots, not his dress uniform boots, but the worn pair he'd worn during 3 tours through Tikrit, the pair she'd retrieved from their garage 18 months after his death and carried everywhere because throwing them away had felt like throwing him away again. She'd pressed her forehead against them and whispered words that sounded small in the open air, words that broke in ways she'd trained herself to prevent. I promised you I'd keep fighting, Marcus. I promised. But I can't even save one kid. I failed. I failed, and now he's going to grow up paralyzed because I couldn't. Her voice had fractured there, something sharp and terrible at the edge of her control, and she'd let it, because there was no one here to see it, no one here to measure her against impossible standards except the man who'd never asked her to be anything but human. She'd sat in that rain for 47 minutes. No shelter. No movement. Just the weight of gravity and water and the knowledge that sometimes effort alone wasn't enough, that sometimes the system was structured to break you specifically because you were the kind of person who would try. 3 days later, sitting in his own house in a part of Houston called Bellaria, James Reeves was making calls of his own. He had connections that Hargrove didn't know about. Not board members. Not administrators. People deeper than that. He called a former teammate from his SEAL days, now working counterintelligence for Naval Criminal Investigative Service. He called a veteran journalist who'd published a major investigation into hospital billing fraud in 2019. He called the Texas Medical Board directly and filed a formal complaint against Dr. Marcus Hargrove, citing falsified evidence and removal of medical staff specifically to cover up billing irregularities and misdiagnosis. He called Patricia Chen and asked, directly, if she was aware that Hargrove had been receiving kickbacks from Medline Supply, and when she denied it, he said, "You will be by Monday." That call, more than any other, changed something. Because Patricia Chen was competent enough to know that a Navy SEAL whose son was in her ICU asking about kickbacks wasn't making idle conversation. She was competent enough to understand that fire, once lit from that angle, would spread in ways that no amount of institutional protection could contain. Meanwhile, Tyler Reeves lay in pediatric ICU room 412, his legs still paralyzed, his vitals stable for the first time in 7 days, his father's face carved into lines that looked like the same expression Natalie had worn in the rain. The only difference was that Tyler didn't know yet that the person who'd saved his life had already been removed from the hospital. The only difference was that he still believed that tomorrow she'd be back, that she'd continue the work that 7 doctors had declared impossible. If you've ever been underestimated by someone who made assumptions about who you were, if you've ever watched integrity become liability, if you've ever believed that one person could change a system and been proven wrong, share this story. Because what happened next didn't just silence the room. What happened next changed everything. Like this video if you support our troops. And if you or someone you love has served, let us know in the comments, we'd be honored to hear from you. Subscribe and let's get back to the story.